You lean down to give your dog a kiss goodnight, and that's when it hits you, the smell. Not the usual dog breath you laughed about for years, something heavier, something that makes you pause. You gently lift their lip, and there it is, a hard yellow-brown crust clinging to the back teeth. Gums that look a little redder than you remember. You didn't see this coming. You feed a good diet. You love this dog. So how did this happen right under your nose? Here's the frustrating truth. This happens to millions of loving, attentive dog owners every single year. You brush when you remember. You buy the dental chews from the pet store. You assume if it were serious, I'd know. But dental disease is quiet. It doesn't announce itself with a limp or a fever. It builds silently, day by day, meal by meal, until suddenly you're staring at a vet estimate for a professional cleaning that costs more than you expected, wondering if you missed something you should have caught months ago. That guilt is real, but it's also incredibly common, and it's fixable, starting today. By the end of this video, you'll understand exactly what plaque and tartar actually are, why they form so fast in dogs, the everyday mistakes that let them build up unnoticed, the daily habits veterinarians actually recommend, and a simple routine you can start tonight to protect your dog's mouth for years to come. What you'll learn today. Here's where we're headed. First, we'll break down what's actually happening inside your dog's mouth. Then, we'll cover the common mistakes that let plaque turn into tartar without you noticing. After that, I'll walk you through the strategy vets actually recommend, the one that makes the biggest difference. Then we'll look at the science behind why it works. And finally, I'll give you one simple daily routine you can start using tonight. Let's get into it. Chapter 1. Understand the problem. Let's start with something most owners never think about. Your dog's mouth is a battlefield of bacteria every single hour of every single day. Within minutes of eating, a thin, invisible film starts forming on the teeth. This is called plaque, a living layer of bacteria, saliva, and food particles. On its own, plaque is soft. It can still be brushed away. But here's what surprises many pet owners. If that plaque isn't removed within about 24 to 72 hours, minerals in your dog's saliva start to harden it. It calcifies. It becomes tartar, also called calculus. And once that happens, a toothbrush alone can't remove it anymore. Only a professional dental cleaning can. This matters because tartar isn't just cosmetic. As it builds along and under the gum line, it creates the perfect hiding spot for more bacteria. That triggers inflammation, a condition called gingivitis, where the gums become red, swollen, and sometimes bleed slightly during chewing or brushing. Left untouched long enough, gingivitis can progress into periodontal disease, a deeper infection that can damage the ligaments and bone holding teeth in place. In more advanced cases, this can lead to tooth loss, chronic pain, and in some dogs, bacteria entering the bloodstream, which veterinarians have linked to stress on organs like the heart and kidneys over time. Small breeds, flat-faced breeds, and senior dogs tend to be more prone to rapid tartar buildup because of tooth spacing and genetics. But truthfully, every dog is at risk. This isn't about bad owners. It's about biology working faster than most people realize. Vet tip. If you notice bad breath, that is often your dog's mouth trying to tell you something. It's one of the earliest and most common signs worth paying attention to. Chapter 2. Common mistakes. Now here's the part almost nobody talks about, the mistakes that quietly let this problem grow, even in homes where owners are genuinely trying to do the right thing. Mistake 1. Waiting for obvious symptoms. Many loving pet owners assume that if their dog is still eating normally and acting happy, the mouth must be fine. But dogs are experts at hiding discomfort. Eating well doesn't rule out dental pain, it just means your dog has learned to push through it. Mistake 2. Relying only on dry kibble to clean the teeth. This is one of the most common myths in pet care. While some dental-specific kibbles are formulated with texture designed to scrape the tooth surface, regular dry food does very little on its own to prevent plaque buildup. Chewing motion alone isn't the same as active plaque removal. Mistake 3. Brushing inconsistently. Many owners start strong, a few days of brushing, and then life happens. But plaque doesn't wait for a convenient schedule. It starts hardening into tartar within days, which means consistency matters more than intensity. Mistake 4. Choosing unsafe home remedies. Some well-meaning owners turn to internet suggestions like scraping tartar off with household tools, using human toothpaste, or applying vinegar or hydrogen peroxide directly to the gums. These can injure delicate gum tissue, damage enamel, or in some cases be toxic if swallowed. Please avoid these approaches entirely. Mistake 5. Skipping veterinary dental checks because the teeth look okay. A lot of dental disease happens below the gum line, in places you simply cannot see during a quick look at home. This is why professional evaluation matters, even when everything looks fine on the surface. Vet warning: never attempt to remove hardened tartar yourself with metal tools or sharp objects. This can damage the enamel and cause pain or injury. Tartar removal below the gum line should only be performed by a veterinary professional, often under anesthesia, so the entire mouth, including x-rays, can be safely assessed. If you've ever dealt with this problem with your own dog, let me know in the comments. I genuinely love to hear your experience. Chapter 3. What actually works? Alright, now comes the most important part of this video. The single most effective veterinarian-backed strategy for preventing plaque and tartar isn't a magic product. It's mechanical removal, done consistently. In plain English, physically disrupting that plaque layer before it has the chance to harden. Here's how that breaks down in real life. Daily brushing is the gold standard. Veterinary dental specialists consistently point to daily toothbrushing as the most effective at-home method for reducing plaque. Using a dog-specific toothbrush and dog-safe enzymatic toothpaste, never human toothpaste, since ingredients like xylitol can be toxic to dogs, gently brush along the gum line in small circular motions, focusing especially on the back teeth, where tartar tends to build up fastest. If your dog isn't used to brushing, start slow. Let them lick a small amount of the toothpaste first. Touch the teeth briefly for a few days before introducing the brush. Patience here pays off enormously. Dental chews and toys with the VOHC seal. Look for products carrying the Veterinary Oral Health Council seal. This means the product has been tested and shown to meaningfully reduce plaque or tartar, not just marketed as dental. Not every chew on the shelf meets this standard. Water additives and dental diets. Some veterinary-formulated water additives and prescription dental diets are designed to reduce plaque through mechanical texture or enzymatic action. These can be a helpful addition to brushing, but they generally work best as a supplement to brushing, not a replacement for it. Routine veterinary dental exams. Even with excellent home care, most dogs still benefit from a professional dental cleaning periodically, because only a vet can safely assess and clean beneath the gum line. Your veterinarian can help you determine the right frequency based on your dog's breed, age, and individual risk factors. Vet tip: this routine works well for many healthy dogs, but speak with your veterinarian before starting any new dental product if your dog has existing gum disease, loose teeth, or other health conditions. Chapter 4. Why this actually works. Let's take a moment to understand why daily brushing outperforms almost everything else. Think of plaque like a thin coat of frost forming on a window overnight. In the first day, you can wipe it away with almost no effort. But leave it long enough, and it doesn't just sit there, it bonds. It becomes something you need a scraper for. Plaque behaves the same way. Bacteria form a soft, sticky biofilm on the tooth surface almost immediately after eating. For the first day or two, this film is fragile. A toothbrush disrupts it easily. But minerals from saliva begin depositing into that biofilm, hardening it layer by layer. Once fully mineralized into tartar, it bonds tightly to the enamel, and brushing can no longer touch it. This is why timing matters so much. Brushing once a week doesn't interrupt the process early enough. The plaque has already had time to calcify by the time you get back to it. But brushing daily catches the biofilm at its most vulnerable, fragile stage, before it ever gets the chance to harden. It's a small daily action with an outsized long-term effect, much like brushing your own teeth. Skipping one day rarely causes visible damage, but skipping it consistently changes everything. Chapter 5. Long-term success. Here's the part that matters most. Dental health isn't something you fix once. It's something you protect, continuously, for the life of your dog. Dogs who receive consistent home dental care combined with regular veterinary checkups tend to experience less gum inflammation and fewer advanced dental problems over time. But consistency is the key word. A few weeks of great habits followed by months of nothing won't provide the same protection. Build dental care into your existing routine, the same way you'd remember to feed or walk your dog. Pair brushing with something you already do daily, before bedtime for example, so it becomes automatic rather than something you have to remember separately. And don't forget the professional side of the equation. Your veterinarian can track subtle gum changes over time, catch early periodontal disease before it becomes painful, and tailor a dental plan specific to your dog's breed and risk level. Safety note: if you ever notice bleeding gums, visible loose teeth, difficulty chewing, pawing at the face, or a sudden change in appetite, these deserve prompt veterinary attention rather than waiting for a routine visit. Daily action system. Here's one simple system to remember. I call it the 60-second dental check. Once a day, ideally at the same time you already interact closely with your dog. Lift the lip gently on both sides and take a quick look at the gum line. Check the color. Healthy gums are typically a consistent pink, without redness or swelling. Smell the breath. Noticeably foul odor is often an early warning sign. Brush for about 30 seconds along the outer surfaces, focusing on the back teeth. That's it. 60 seconds. One small habit, repeated daily, is what actually protects your dog's mouth over months and years. Let's bring it all together. Plaque forms constantly and hardens into tartar within just a few days if left undisturbed. The most common mistakes, inconsistent brushing, relying on kibble alone, and unsafe home remedies, quietly allow this process to continue unnoticed. The strategy veterinarians consistently recommend is simple. Daily mechanical plaque removal through brushing, supported by VOHC-approved products and regular professional cleanings. And the daily 60-second dental check gives you one easy habit to keep it all on track. You don't have to be a perfect pet owner. You don't need to brush flawlessly every single day or catch every early sign immediately. What matters is showing up, consistently, in small ways. That's what protects your dog, not perfection, but persistence. Every time you lift that lip, every time you pick up that toothbrush, you're not just cleaning teeth, you're paying attention. You're showing up for the animal who trusts you completely. That makes you exactly the kind of pet parent your dog needs. If you enjoy veterinarian-approved pet health education, subscribe for new videos every week. Together, we'll help our pets live longer, healthier, happier lives.